So welcome back to Season 1, Episode 2. I'm grateful that you're all choosing to share your lunch with us as we do podcast science. I'm Johnny Lifshitz. I will be a professor of physical medicine and rehab at the University of Michigan in 6 weeks, as well as at the Concussion Center, and thrilled, it probably is an understatement, to be here with my friend Carrie Esopenko.
And I'm Carrie Esopenko, and I'm an associate professor at the Icahn School of Medicine at Mount Sinai in New York City. And Johnny forced me to be here, and no, I'm just kidding. Totally thrilled to be here as well. We are so excited to see so many people in this room again. We're going to get this going and get started. We have a pretty packed hour.
And as you may be already familiar, we're trying to disseminate information around research on traumatic brain injury to be able to get the perspectives and the challenges, some of those things that are not necessarily included in papers, to get a more full understanding of comprehending traumatic brain injury, the challenges that the survivors go through, the challenges that the providers go through, and the strains that it puts on the community and those resources. When we were going through the abstracts, we identified a theme, and that's how we chose the topic of this particular conversation, which is about survivors and those living with traumatic brain injury who are going through transitions in their life, whether it's a childhood to adulthood, from inpatient services into the community, and a variety of other ones that we actually had to overlook because we could only fit 3 of them into this particular podcast. I want to just start off with a comment that came about. I don't have a lived experience with a traumatic brain injury, and so I have a huge deficit in being able to run research studies with human patients.
And I do come to this field with a lived experience, and I think I bring that into all components of the work that I do. And I think as we've been moving forward and talking more about community integration, we've started realizing that including our people with lived experience in our research is extremely important, and it provides a perspective that we, in some cases, have been lacking for many years as we've been designing our studies, as we've been interpreting our results. And I think even more importantly, as we've been trying to implement our findings into care. And as we know, the implementation gap is huge. We're looking at 17-year implementation gap from when a research study ends to when it gets into clinical care. And that is extremely problematic. And so including our community within the work we're doing allows us to go from literal bench to bedside to, as Johnny would say, community.
And so with that, it reframes where we're going with this, is to be able to take the lived experiences of individuals and ask the question, does it apply to the next individual? Does it apply to the local institution where services are being provided? Does it apply to the region? And with regards to that, everyone's going to bring their own perspective. Everyone's going to identify different challenges, and everybody's going to want their own transitions. The transitions could be as simple as finishing the academic year, or it could be becoming employed, or it could be a particular social relationship. And so the discussion as we move forward really does focus on the community needed by individuals in order to live the life that they have become used to, or have become I have a whole bunch of words I don't want to say about this. But to live the life, which life, Carrie?
A stigma-free life.
There we go.
I would say. And so a big goal of today's podcast is really talking about reducing stigma. That's better. Reducing stigma and building community integration for our individuals living with TBI. And that brings us to our first podcast speaker. Please welcome Gifty Asair.
Wonderful. Good afternoon, everyone. Thank you so much for having me on today. I'm very excited to share more about living at the intersection of gender-based violence and brain injury. And I think that this is a very nice segue from yesterday's conversations where we had Lynn share with us about community and action and how we can all be a part of action in community. And also Lynn was integral in the initiation of this project as well. We also had Tori speak to an overlooked community, that of queer folks, and then we had Carolina share about how we can bring clinical intervention and rehabilitation to survivors where they are at, which is in shelters. And so I'm going to share today more about how the research can be approached and be done and centered on survivors, and also just a little bit more about what works or what we have seen works, so the practical aspect and implications of this. And so we've heard a lot about the incidence and the prevalence of intimate partner violence, gender-based violence, and brain injury at this conference, which I'm very excited about. And so I won't reiterate necessarily those findings, but just noting that in Canada, during COVID-19, we noticed a 20% increase in the reporting of intimate partner violence. And so it is crucial and imperative for us to actually find out how we can support survivors and how we can do that as quickly as possible, but as effective as possible as well. And so it was terribly rude, but I didn't introduce myself properly. My name is Gifty, and I worked in academia quite a bit, but more recently, I've been working with an organization called Women at the Center. And when Carrie and Johnny invited me to share about this research, they asked, well, what drives you and what is the passion behind this research? And so I'm a survivor of gender-based violence, and I've also experienced a brain injury, a sports-related brain injury. I played rugby, varsity rugby here at Concordia University for 3 years and sustained 3 brain injuries. And so this research, this project, these initiatives are very dear to my heart because I'm able to actually apply these findings to my everyday life and kind of see how to heal. And so Women at the Center is a nonprofit organization that is for survivors and by survivors of gender-based violence. And it's looking to eradicate gender-based violence. And so in this project, we had a 20-week program. And the objective of it was to co-adapt, pilot, as well as evaluate an evidence-based, trauma-informed, cross-sectoral, multidisciplinary program that would essentially support survivors, but also tell us what works. So in it, we had 8 services that you can see, like one-on-one peer counseling, music therapy, naturopathy, physiotherapy, and the like. And the one-on-one peer counseling was on an ad hoc basis, and so survivors could essentially engage with it as needed. And all in all, really to delve into how this program was conducted was that survivors were at the center. So not only were they like in the consultation or maybe just planning, but also in implementation and essentially invited to be the expertise and the experts of the program that would support them. And so we had the Women at the Center Expert Collective, and that is recognizing survivors and their lived experience as expertise to inform us of how to do this program. And then more importantly, to also include live adaptation. So as we are actually working on programs, we're learning at the same time, but we're implementing those learnings as we go on. And so some of the findings that we kind of saw was that there was increased general mental health, general health as well as mental health, and then the difficulty to complete daily tasks decreased. In that same vein, we also saw less symptoms being reported, and then also the severity of those symptoms decreased over the 20 weeks. But importantly, in the qualitative aspect, survivors shared that peer support, the one-on-one peer counseling, was beyond instrumental in reducing stigma, reducing shame, empowerment, and for them to actually feel heard and also feel a part of their own healing process, which goes a long way. And then a step beyond that was peer navigation, which is essentially peer support, but with also training and navigation expertise with regards to some of the challenges that a survivor might face, whether it's with court systems, whether it's with childcare, criminalization, and the like. And so that was one of the big findings of this work, but also kind of moves us to really have an integral consideration of survivors in their healing journey, and also peer support and navigation and the role that it plays in it all. I could go on forever, but I think I'm gonna stop here so that we can ask me more questions.
Come join us at the table for discussion.
So I want to dive into, actually come off a point that Johnny made yesterday, and that's that words matter. And so a lot of what you're talking about is empowerment and centering. Can you talk more about how important that has been for this recovery that you were seeing?
Definitely. There's so many ways I could take this. So words matter, language matters, and at the organization, that's something that we're always working on and adapting. So for example, you might have noticed the use of the language gender-based violence. And that is a learning from survivors, letting us know that sometimes the violence that they experience is not from an intimate partner or someone they would consider an intimate partner. And so gender-based violence encapsulates not only domestic violence or intimate partner violence, but as well trafficking survivors, human trafficking survivors, and also folks gender diverse and trans folks as well. And so it's empowering to not only shift and adopt language, but also to know that when survivors say, this is not language that includes me, we adapt to ensure that folks are included and also a part of the narrative and the discussion.
I really like that part about making sure that the person, the individual, is receiving an environment that they feel is tailored towards them, because then they're going to latch into it. If we use the wrong words or the wrong title. What caught my attention about the work that you're doing is the idea of peer mentoring and the peer one-on-one. And this may sound awful, but it reminds me of people who adopt dogs and it says, who saved whom? Right? So in this peer environment, is it the new survivor or the old survivor that's benefiting from it?
Very interesting question. It's definitely bi-directional. And I think it also speaks to, it's a very nuanced relationship and a complex one, because you definitely have your peer support and peer navigation. One of the constructive feedbacks that came from this program was something like risk of re-traumatization or triggering conversations, right? And so having support for the peer navigators is as crucial as having support for survivors that are going through the program as well. So I appreciate you bringing that up.
And it goes back to the comment we made yesterday about brain injury being a perpetual cycle of recovery, that you may be the patient, you may be the peer advisor, but it really is a perpetual cycle of recovery.
So it looks like it works, right?
Yay.
This looks like it's really benefiting everybody that's at the center. How do we scale that? How do you get it out there so that others can adopt this and really help and embrace this very empowered method of recovery that you have developed?
Thank you for asking. One of those ways is here in this podcast, so please tune in every week. No, but sustainability and knowledge mobilization is a huge part of this. We definitely also have some learnings about how to share this knowledge, bring awareness about it, and also make sure that it's adapted for different communities, different, rural, urban, countries and the like. It'll definitely take more funding, please, but it'll also kind of take community and collaboration. We have here like the wonderful Kelsey, who was instrumental in the knowledge mobilization. So everything from, you name it, we held like a huge 3-day conference. We're making sure that it's French and English. We're ensuring that we've got the reports and knowledge mobilization website, and that we're also networking with folks and seeing how that can be applicable for them in their own research and their own programs. But at the end of the day, also, this is, again, practical knowledge, and so survivors, and how they can kind of take this with them and how they can utilize this for their own healing journeys.
Yeah, you're building such a strong community that people will want to put on bumper stickers and shirts and bags and water bottles and all those things. The challenge with that is we want to make sure that those communities don't stigmatize the individual by saying, I participate in this program, and then all of a sudden they have a label on them. If they do have a label on them, it actually is a challenge because that label can further marginalize them in terms of their community. And to discuss that, we have Jade Witten joining us to share their poster on how integration in the community may change the perspective of the survivor. This podcast is brought to you by the Canadian Center on Brain Injury and Intimate Partner Violence. The newly launched Brain Injury Center on, yes.
Hey, thank you. Hi, everyone. I'm Jade. I'm a postdoctoral researcher at the University of British Columbia in Vancouver. And this is a project our lab has been working on collectively about the long-term experiences of community integration after traumatic brain injury. So just very briefly, we know that moderate to severe TBI has chronic impacts to multiple facets of life. And we know that community integration, or connecting with the community through engagement in meaningful activities, is one of these facets. And it's also been identified by individuals with TBI as something that, if supported, could improve their quality of life. So evidence suggests that community integration is poor in the acute phase of injury, so usually within the first year of acquiring the injury. However, the long-term manifestation of these experiences are not well understood, and so that was the aim of this project. So this was a project from a larger mixed method study that looked at priorities for improving quality of life after TBI. And we had 13 adults living with moderate to severe TBI in British Columbia participate in online focus groups that discuss factors affecting quality of life. So we identified 3 themes from the data relating to community integration, and as measured through 3 areas of employment or productive activity, independent living, and social activity. And so the first theme, Am I Left on My Own?, highlighted the impact of healthcare and social support systems on community integration. So in particular, there were quite a bit of disparities in the provision of long-term support, with some participants reporting the loss of rehabilitation support once they were discharged from hospital that affected their transition to independent living, while others reported that they had ongoing support. Similarly, some participants reported losing friendships because, for example, they now had sensitivities to environmental stimuli when engaging in certain social activities, whereas others reported having ongoing support from families and friendships from before the injury. The second theme, One Size Fits All, highlighted the impact of societal expectations on community integration. And so here we're talking about experiencing stigma and prejudice from having an invisible disability in employment and public settings. So One participant spoke about needing to show proof of having a disability, so taking out their disability pass in the bus in order to be able to get a seat. The last theme, adapting to a new normal, highlighted the positive impact of owning a new reality and embracing the present on community integration. So in other words, participants reported finding meaning and purpose by engaging in productive activities that fostered new skills. So for example, one participant took a cooking course and became a cook. Or another participant became a peer support volunteer for individuals who'd acquired their injury more recently. So where do these findings leave us, and what do we as researchers and also members of our own personal communities do with them? So firstly, we might consider addressing the gaps in long-term healthcare and social support by developing sustainable community-based programs for individuals and families living with TBI. So for example, one of the projects our lab is currently working on is a peer support program for individuals with brain injury that's been implemented in partnership with brain injury community organizations in British Columbia, in the hopes that the program can continue to be developed and delivered through the community after the research has ended. Secondly, to reduce stigma and prejudice, we might consider developing public awareness and education programs about TBI. So as researchers, we know TBI is a common injury, but the general public, this is not a fact for them. In fact, many individuals are not familiar with the term TBI, or that there are varying levels of injury severity and associated impacts. So what can we do to create more awareness on this topic in an impactful way? And I have a couple of ideas for this. Maybe we'll get a chance to discuss it in a little bit. And then the last thing is to try to foster hope, positivity, and resilience through family and care partner support programs, and support meaningful engagements for individuals living with TBI in the community. So, for example, how can we support individuals who maybe want to join a recreational sports program with others in their community, and maybe also a program or activity that's not just for individuals with disability, but for anyone from the community where their injury is also understood. Thank you.
Thank you, Jade. Come join us up at the table. So we're building on that theme of community, which is, without a doubt, even if you've not been an individual with a lived experience with a traumatic brain injury, the community that you knew prior to the injury is going to necessarily change after the injury. And what captivated me by your submission were just the brief phrases, like, you are alone, you are in this abyss. And what I really like about the way you laid out your abstract, your poster, the presentation, is the storytelling. And can you just speak for a moment about the storytelling, what it means for a survivor or an injured individual to hear someone else's story and marry it to their own story to give them the hope you were talking about?
Yeah, for sure. I think for others to hear these stories is very inspirational, and also maybe even provides a sense of belonging and a sense that I'm not alone out there. I think it can be very isolating after this happens, and relationships change with families, with friends. And so what happens is, I think from what our participants said, they tend to sort of move towards groups that have shared similar experiences with them. And so I think just having that connection with somebody who's, okay, they get me, like, we're going through this together and we're not alone, is incredibly inspiring to move forward with life, and like to look at positive things, and how can we do something that's meaningful for us, even if it didn't mean as much before the injury. Like, now I'm going to go and I'm going to try something different, and I have the support from people who feel the same way.
Goes back to empowerment that Carrie.
Yeah, this whole thing of empowerment it seems to be this profound way of recovering, and that how we can empower our survivors seems to be what's really driving their recovery. And since you set it up so nicely, is that underlying some of your future directions that you would like to do?
Being empowering, I think so. I think we want people to feel like they can do things. They have the ability to do that. But I think the onus is also on us as a society to help with that. I think at the moment, we all know what's happening is that people feel marginalized and isolated, and that doesn't help them to embrace, a new reality. So I think we can also do a lot as individuals to help people feel like they're still accepted in the community, and they've had an injury, but they're still a person living. with everyone else.
So on that and the invisibility of brain injury, how do we do that without, making the person have to yell from the rooftops, I have a brain injury? Because that is almost unempowering, right? So how do we do this and still empower them without them having to every time and everywhere be like, I have a brain injury, help me, support me? How do we set up these communities for them?
I think that's where we as researchers have a vital role. Like that's, I feel like one of, at least in our lab, we're trying to do that. And even, so I was thinking about like what short things that would sort of grab the general public's attention. So I've sit on the bus sometimes and I look up and I see an ad there and I'm like, that's amazing. Just a few words to explain, this is a TBI, it's really common. And something about sort of, not passing judgment because just because you can't see anything doesn't mean that there's nothing to see there. So I think a lot of public awareness campaigns and then maybe also reaching out to groups that are already doing this work. So I'm sure there's a lot of disability support groups globally, and I think kind of using those groups as a platform to spread the message and maybe also to expand the definition of disability. Like it's not just what you see, it's also what you don't see. I think that could be a great way to spread the word.
Based on your background, we're addressing this conversation from a research standpoint, but it really is education. It's awareness. It's uncovering that information which we probably can accept is real. We just need someone to guide us through that. And with both your presentation and with Gifties, a thought that came to mind was, at least many years ago, I was taught to use person-first language. Is it is it necessary to use community-first language? So to say someone's a brain-injured community as opposed to a community of brain-injured individuals or community of individuals with brain injury. So you got community-first and individual-first language. I know I'm putting you on the spot, but any thoughts about community-first language? No?
I've never heard it put that way. Any thoughts? I'd say we have to ask the survivors and see what they like.
Yes.
But I like where like the intention is, which is essentially making folks feel inclusive and also in group and not so much as an out group or an individual that's isolated. And if that's what that achieves, then by all means.
I include the survivors should be at the front of our mind. Along the same lines, another one of the mottos that I live by is that you can pretend to care, but you can't pretend to show up. And so with that, whether it's Gifty putting together a community program or Jade putting together a survivor panel to learn about those communities, once you build it, you have to have somebody show up and participate in that particular community. And in order to learn how participation changes and adjusts for each of these survivors, we're asking Judy Wilson to join us and talk to us specifically about the elements of participation that will help those communities thrive. That's the word I'm looking for.
So, is it up there? It's here.
It's here.
No,
It's
let me
there.
pick it up and go.
Game on.
There it is. So I'm Judy Wilson, and I'm an occupational therapist at Bellevue Hospital, and I study and also work with New York University. And part of, well, I work at Bellevue Hospital, so it's a city hospital in New York City. And as such, I witness people with brain injuries during a huge life transition. Dealing with the functional changes as well as the social dynamics that surround their lives. And I question how much those experiences match what I've learned in textbooks and in the current literature. I know there's very disparate outcomes, and I want to understand what the lived experience is better. So my research project seeks to look deeper, more systematically at this what this transition looks like. Focusing on men of color, so that as a healthcare professional, we can have fuller, a broader understanding of people's lives after brain injury. I'm looking for a rich and detailed understanding of how people put their lives together after an injury to move beyond the numbers and norms that measure outcomes. So I used a qualitative approach to collect data in hopes that these details and specifics guide us clinicians in tailoring treatment and asking better clinical and research questions to improve care. My research consisted of meeting with someone with a brain injury and someone they identified as important in their lives. And we had a long conversation, a three-way conversation, and also actually included them making a visual activity map, which is what you see in those pictures, is some samples, to provide different ways of showing me about their lives and what they look like. So what I've picked up so far in this process is that when I asked a person with a TBI to bring someone important in their lives, they brought to the interview not just their mother or a wife, but also brothers, friends, an aunt. It was a very diverse group. I don't like that. I used the concept of participation for my study as a focus. Comes from the World Health Organization's outcome, defined as involvement in a life situation, and it parallels the occupational therapy concept of occupation. And I found that the people I talked to latched on to the concept. They all identified activities that were meaningful parts of their life. And one described these activities as, quote, its joy. And I think that's a really important thing to shift our focus to, or find our focus in helping these people, helping people at this point in their lives find what's important to them and focus on that. A basis for my research was an interest in the social factors that impact participation. And I found in their frustration, I found these experiences. The frustration with social attitudes, confusion navigating the health system. But most people were hesitant to focus on this area. And it seemed to be an element of pride in sharing what they cared about most. I'm going to quote someone. So, social factors, as one person said, quote, mean absolutely nothing to me. Not because social factors didn't impact, they impacted hugely, but because he chose to focus his story about himself. So he chose the narrative that was coming forward. And using qualitative data in interviews and the activity maps they made brought meaning to participation as an outcome. It let me see the emotions tied to the activities, the joy, the frustration, the loneliness, and the complexity of their experiences, raising questions about work, social ties, and the interplay of the brain injury with many other issues in their lives. Brain injury is one of several factors they were negotiating, forming meaningful life with the activities and people that mattered most to them.
Thank you, Judy. It almost sounds like we're reading a narrative review about this because of the overlap between all the different topics and how they're each building community and really focusing on one of the same things, which is listen to the survivor and then identify what their needs are. But that's really resource intensive, unquestionably. You can't just open up a book. And so you're really talking about precision treatment or precision activities. Again, I'll use Carrie's concept of how does this scale? Can it scale? And unfortunately, we have a large pool of brain injury survivors that are going to continue to feed the pipeline. But what are your thoughts on scaling?
So yeah, in terms of, I had some great conversations with some great people about, their really interesting lives. But yeah, what do I do with that going forward? But I do think it brings attention to where to focus, how to address needs, support, quality in their lives. And sometimes I think we get all burdened down with what are the barriers, those are important. What are the deficits? We do need to analyze that, but that doesn't necessarily need to be our focus when we're working with people? What are the things that bring them joy? What are the activities that are valuable? During someone's poster, trying to see if they're here, yesterday, they used the concept of flourish. How do they flourish? And maybe it provides, it helps people kind of reconnect with what's really important in their lives. And if we can use our interventions to focus on that, without disregarding all the challenges and all the difficulties, but to take those positive pieces and use those as the building blocks so that it's their story about them and what is valuable to them and what brings them joy.
And I love this concept of joy because I feel like sometimes a lot of the new normal doesn't include joy, a lot of the time. And so as we're thinking about rehabilitation and helping people recover and empowering people to recover, the healthcare environment is oftentimes quite sterile, right? How, and as a clinician, how can we do some of these things and make it more participatory and provide them joy in these environments so that we can actually, say do a neuropsych test that doesn't send someone out feeling worse than they came in, and give that joyous experience. Like, what can we do to improve this and include that participation and make that survivor feel empowered leaving?
Yeah, I think it's shifting that conversation. They do that neuropsych testing, or they come and we all know everyone comes into a clinical setting and they say, I have problems with my memory.
Yeah.
And most of the time it isn't even a memory problem. But then once we can help figure that out, but to that shifting of the conversation to what are the things that you're doing that are joy providing, what are the things that you really, really want to do, and let's focus on those pieces, break those down, find ways to readjust that. And sometimes there's a lot of pushback, because you just want to get back to how things were. But I think we talked about narrative. That understanding of narrative, and I think talking with some of these people that I spoke with, some of them I spoke about how I know I can't have my life go back to when I was 20, because I'm not 20 anymore. Like, forget the brain injury. Yeah. Life changes over time. So that continuity and their ongoing story and keeping that going. And there's a lot of different modalities that are out there. And you've talked about how to use the brain injury community. And it doesn't have to be in that specific community, but using the people around, using other people, using support systems that encourage an ongoing story.
And I'm integrating all the information that we're learning here and thinking about the person who's providing the support. I'm thinking about the person who's receiving the support. And Gifty told us, well, both of them are giving and receiving support at the same time. And then we think about the built environment that much of this occurs in. And Carrie was hinting at this. An academic testing room is not inviting. A hospital is not inviting. And it starts with the parking lot that nobody likes. How do we use the built environment? What does it look like to not have somebody show up with stress and anxiety because of the environment they're in? Have any of you thought about how to set the stage so it looks like they're entering into a world of joy as opposed to a world of interrogation, not interrogation, discussion and academic noise? And on top of that, how do you then maintain the integrity of research so you can collect quality data and you can report on it and you can tell your funding agency what's going on, so you're not losing that, but you're gaining everything else? And maybe I'll simplify the question. Like, have you done anything to the environment that we can tell our audience, perhaps you want to do these things because it made it easier for survivors to show up?
I'm going to kick it off because I work in an inpatient rehab facility in a large general hospital, even though my research is farther down the road, because I want to know that target. But we have, and some occupational, this will speak to the occupational therapists, but I think it goes beyond just that because, yeah, how do we make places feel a little more natural, homey, less hospitalized? So how we set up things so there's a comfortable living situation, so the walls aren't like stark. So we have a kitchen and a bedroom and actually we have a little subway in our place. So making those changes helps, and I love to get people outside and wandering around Manhattan as part of therapy. Yeah, it's good to live in Manhattan for that part, because we can get outside. But so those things help treatment at that point. But then I think big issue is then as we push it down the road to the, once you're in the community, I can't wait to hear.
Yeah. Any thoughts,
So much more
Gifty
can
or
happen.
Jade?
Thank you. Yeah, I can share a little bit. So we work more in a remote and virtual setting, and so definitely need to think about how that space is inviting in its own way. And just in this project, there are a few sentiments, positive sentiments that survivors shared, and one of them was their social location being addressed, which speaks to having representation, which I know is a hot topic right now. But essentially, I think that it can be undermined just how being in a space where you see people that look like you actually matters. Like, it makes a difference. I notice it all the time. And so even in that remote space, and we have another project called Black Women, Girls, Gender Diverse, and Trans Folks. And in this project, I think that it's really like blown my mind just how much more open, vulnerable folks are when they're in a space where they feel like this is like an in-group, like everyone looks like me, and so I'm comfortable being who I am in this space. And so that's one of the ways, anyways, we found is very supportive when folks are able to see their intersectionalities be reflected. And then in that same vein, though, there are some barriers to the remote space, and that has been shared as well. There are folks that would have preferred to be in person because something like physical touch, which is a challenge and which they might have had difficulties with, is something that they've now come to they've shared that essentially they've been without and something they would appreciate having. So something like asking, what do you want to hug? And knowing that that's available is something that makes an environment feel safer. And so those are just a few examples of what we've noticed, but that I think that it's something we can all think about as well as we do the work.
So we've talked about this as like safety and joy, but how do we now move into building agency of our survivors so then they can get these experiences?
I mean, I think we need more support groups.
Yeah.
And I think just not just support groups. I think in our treatment settings, we can use groups where then it's not about me as a clinician, it's about learning from each other and working with each other. Yeah, I think also linking in, and one of you I think you touched in on this, Jade, is using groups not just about brain injury, but one's about disability or one's about rugby groups, we were, Gifty and I were talking about rugby right before this. So, but like even they're around interest groups when we can build off of that and have them grow within that. I remember observing in a YMCA once. It was like a class assignment where I literally was just spying on people.
We call that research.
Yes, that's
yeah,
what they were calling it too.
Okay.
But it was like there was this very natural group that formed in the little cafe area of people, and one of the people I am 100% sure had a brain injury, and other people had all their different issues and whatever. But you could see how this natural group formed and supported, and they clearly got together very regularly before they went and did their morning exercise or whatever. That kind of thing is wonderful to see.
Yeah. So, I mean, another underlying theme is that community builds resilience. I think a strong community builds resilience of that community within the global structure of society, but it also builds resilience among each of the participants in that community. Those participants, excuse me, then hold each other accountable. They hold each other accountable for lifting each other up, for that bidirectional serving each other type of information or recovery process for each of them, which I think is quite remarkable. And what I really value about this particular discussion, Carrie, is that many times we read epidemiological articles. We all have slides that start off and says, in the world or the United States or any of the other countries, so many people have a brain injury, so many people have IPV, and the person gets lost. And this conversation reminds us that it really starts with the person, talking with that person and building those communities.
Yeah, I agree. And we really today wanted to make sure that we had, and I'm not even meaning to do this as a pun or something, but to put our survivors' experiences at the center. And we wanted to make sure that, you know, we have been talking a lot about epidemiology and prevalences and outcomes, but I think we would all benefit immensely from taking in the perspective of lived experience. And as you all told us here today, there's many ways that we can empower and give a voice to our survivors, and that's going to help us implement, you know, these community-driven, survivor-driven programs of care that allow them to recover and feel empowered, and then go out into the community and live a joyful life.
I think you hit on every one of the key words on that one, Carrie. I don't think I can top it. If there are any closing thoughts from our three speakers today, we're happy to. I'm seeing a lot of absorbance of information in your faces, which is great. I'm going to say thank you so much for your attention, for coming back to this. We're joyed at the feedback we got from yesterday's podcast. We're thrilled this is the last one because it actually is work. It will be put online once it gets edited down, and there may be more coming.
And yes, yeah, the episodes will be coming. But also we wanted to say thank you to IBIA for giving us the space to do this and to provide a different way of presenting research and giving a platform to people doing this really important work. And so thank you to IBIA for giving us this platform, and to all of you.